Joining me this morning to talk a little bit about how to stay safe during the cold and flu season and also the coronavirus season. Penny Hill is joining me on the phone from San Juan Regional Medical Center. She is the infection control manager at the hospital. Penny Hill, good morning.
Good morning, Scott. Good morning, everyone. Hope this finds everyone well.
Right, exactly. And that means a lot this year for sure. And so it's good to have you on with us because, I have to admit, Penny Hill, you and I have known each other for a long time. And I think you get to say, Scott, I told you so. Because I can remember decades ago when you would tell me how to wash my hands and use a paper towel to open the door to the bathroom and do all these different things that we're now doing. I'm doing it more and more every day, and I keep thinking of you when I do these things.
Right. Well, that's a good thing.
Yes.
That's a good thing. It is a good thing. So my message was good, and now more than ever, all of those ways to keep safe are so important, and we've all learned a lot, I think, over these last 6 months.
Very true, very true. But let's talk about that. And so, again, your job is as infection control manager there at the hospital is to kind of keep everybody aware of proper hygiene and what they should be doing and all the other things, nooks and crannies at the hospital. Tell us about your job a little bit.
That's right. My job's been very challenging this year, and because the focus is on staff members, physicians, everyone wearing the right personal protective equipment so that they stay safe while caring for these very, very ill patients, and that we don't spread any of the COVID from patient to patient. So in general, that's my job, keeping employees safe and keeping patients safe while they're at the hospital. So this has been a big learning curve for all of us, and I think we've done really well, and continue to change and update and get new guidelines out to staff. So it's been very challenging, but I think we've done really well. We have an awesome team here at San Juan Regional in our incident command team, and just everybody's done an excellent job.
Right. And even in the days pre-COVID-19, pre-coronavirus, I mean, you still had a lot on your plate too, right? Keeping the hospital and keeping all the staff, as you mentioned, kind of safe, even when there wasn't a big infectious pandemic running around.
Definitely. This is just icing on that cake, so that's what we'll call it.
Very true. And so let me get back to what I mentioned a little bit before, Penny Hill, because you know, we've been talking, as I mentioned, for a long time about the work that you do, and I know for you it's probably second nature, but for the rest of us, you know, some of these things that are now hopefully second nature we're still kind of new back in March, like making sure we weren't touching our face and washing our hands more frequently and doing all these things that you've been preaching for years.
Finally, everyone's listening, maybe.
Right, I know.
Well, and it's just the way that germs are passed person to person, and we know how to prevent that, and we just need to do those basic things that, you know, our parents or our grandparents taught us years ago, is to, you know, wash your hands frequently, especially when you're in public places. But now it's taken on a new level with COVID, in wearing masks and not touching surfaces in public, and it's taken on a whole new meaning that I think it's those basic infection control prevention and strategies are definitely in place, but everyone's more cognizant of them these days, which is a good thing, I think.
Right. No, I agree. Definitely, it is a good thing. And so when we talk a little bit about doing these things and helping to do these things, and let me transition a little bit into the maybe cold and flu season that's just ahead of us. Are you hopeful, fingers crossed, that we have maybe a milder cold and flu season because all of us are now so used to washing our hands and not touching our face and wearing our masks? Could that help maybe have a milder cold and flu season this winter?
I think it might. You know, the flu is spread by close contact with others, so wearing a mask in public and washing your hands, you know, may have an impact on the flu season as well. I think we really don't know how that's going to play out as states open up and we have indoor dining and school opening up. And I think it's a little early to know.
Sure.
But I think that those basic principles of wearing a mask in public, that will prevent flu from being spread as well. Washing your hands, not going to work when you're sick, not going out in public when you're sick. All of those things are going to help to mitigate, I think, the flu spread this year. I'm hoping that everybody really considers getting their flu shots, because that's the main way that we're going to have immunity and prevent the spread, in addition to all of these other things that we're doing, like the masks and hand washing and staying home when you're sick. So all of that will help.
Right. And I know, I think the hospital and others are about to announce maybe some of the schedules for flu vaccines and things like that in the next few weeks to let folks know when they can get their flu shots. But that's been an important message, I think, every season, of course, to make sure folks get their flu vaccine. And so with this, plus the coronavirus, I guess if we're not careful, we could see an overwhelming of our hospitals again with sick patients, whether it's flu or COVID or both or what have you. And that's what we don't want to happen, right? We've tried to avoid that all summer.
Right. That is exactly right. The healthcare systems have already been overwhelmed with COVID, and certainly if we had a surge of influenza patients this fall, that would certainly add to that current strain. So it's more important than ever to get your flu shot. The symptoms are really similar to COVID, but preventing the flu will definitely save lives and preserve those precious healthcare resources. And we really don't know how deadly COVID and influenza will be together, but my guess is it will be just that. It will be very deadly together. If a large portion of our community is vaccinated against the flu, it may decrease hospitalizations and death from one of these two deadly diseases. So I think we just have to not forget that tens of thousands of people die each year from influenza, and hundreds of thousands are hospitalized each year. So if you can have any effect on that by taking your flu shot, I think that's the big important message this year.
Right. And I would say, too, I know a lot of folks say that. They say, well, a lot of people die from the flu every year, and you know, what do you say to that? And that's with a vaccine. I mean, that's my point, is this can still be very deadly for folks and affect their health even with a flu vaccine, whereas with COVID, we don't have a vaccine just yet.
Right, that's true, and we don't really know what that's going to look like. The COVID vaccine. I know that we've been working with the New Mexico Department of Health, and they've been working with communities about COVID vaccine planning at this time. It looks like it's going to be two vaccines initially, spaced apart, by a month or so, similar to when other vaccines are given for the first time. Measles, mumps, rubella, or chickenpox vaccine, you have to have more than one. The first one sort of starts that immune response, and then the second one really gets it going. So I think more to come on that.
Sure.
We don't really know exactly what that's looking like, but we are starting to work with the Department of Health and locally and at the state level to see what we can do about that. But back to flu vaccine, we really want to make sure that everybody gets a flu vaccine this year, especially. It's recommended for everyone 6 months of age or older. And we've seen even some states requiring this for all school-age children and college students to get their flu shots.
Gotcha.
So I think that's a good thing.
Right. And I know, Penny Hill, I think you would agree with me, if anyone had a specific concern about the flu shot, I mean, if they asked their primary care physician, I mean, they should be able to explain how a flu shot works and hopefully try to calm any fears that anyone might have about getting a flu vaccine because of all the benefits that it does provide to individuals and their families. If you've got elderly folks living in your household, that's an at-risk population.
That's exactly right, Scott. So the CDC tells us that hundreds of millions of Americans have safely received the flu shot over the last 50 years. I know that sometimes I have a little bit of a sore arm. I think a couple of times over the last I don't know how long I've been getting the flu shot, 25 years or more. I've had some mild body aches and a headache maybe the evening after my flu shot, but those are normal side effects for the flu vaccine. It really just means that your immune system is working and responding to it. And so you should expect that. I know I went to my doctor and got the 2 shingles vaccines, and that's exactly what he told me. He said, so you're going to be kind of achy the first day. A lot of people have had that, but it just means that your immune system is responding, and it's not going to be anything that's going to land you in the hospital. It'll actually keep you out of the hospital. So keep that in mind.
Right. Very true. And I think these days, and correct me if I'm wrong or if you feel differently, that people are a lot more aware of their health because of what's been going on. And if you get the sniffles or a cough, you're kind of concerned about what that might be. And so I think folks are taking a lot more interest in their health, maybe a lot more active in staying healthy and making sure that they are doing all the things that you have just advised us to do with washing our hands. And so hopefully if they hadn't gotten the flu shot in the last couple of years, this year might be the year to change that.
I'm hoping so. I really hope that everyone considers it, especially this year. I think nobody needs that on top of the potential for COVID in your household. We've seen how easily COVID can spread person to person in your household. Well, flu does the same thing. It can spread person to person, and some of your higher risk family members, like you're talking about the elderly or even new infants,
right,
could end up in the hospital and very, very, very ill, or even pass away because of their infection with influenza. So all of that's important. I think this year we've learned how it's spread, and we've learned how to prevent it from spreading. So I think we need to apply all of those same rules to influenza and get really good at preventing the spread of the flu.
Right. I definitely agree with you. And again, those vaccines will be available soon. I know some folks in some clinics have already gotten their supplies in. They're maybe planning to roll them out maybe October 1st, I think is the recommendation from the CDC. But we'll see what other folks are doing.
Right. The really recommendation is get it as soon as it's available.
Right.
I think definitely by the end of October. I'm seeing flu vaccine flyers from retail pharmacies already available in the community. So consider getting it any time now. And there's a special vaccine for people that are 65 or over. That's called a high-dose vaccine. So studies have shown that these are more effective in preventing flu in older adults. I say that carefully because I'm approaching that.
Right.
More effective in preventing flu in older adults than the regular vaccine. The high-dose vaccine actually contains a combination of a regular flu vaccine and then an immune stimulator portion of it, which causes a better response to the flu vaccine in older adults. Because we know when we get older, our immune system doesn't work quite as well as when we're younger. So I think that's a really important thing. If you're 65 or over, you should ask for the high-dose flu vaccine because it's more effective in preventing the flu.
Good advice. And Penny Hill, let me ask you, is there any downside about getting the vaccine a bit earlier in the season? Would it has enough, I guess, potency to last the entire flu season if you get it now as opposed to waiting until October 1st or October 15th, whatever it is?
There's a differing of opinion on that, and I did read something that said it should last at least 6 months. I've read in other publications that it should last at least a year, and we get a new flu vaccine each year because it's a little bit different strains that's contained in the flu vaccine. So I always get mine in October, just after the 1st of October, or late September. So I think any time is really good, and it should protect you for the entire flu season.
Okay, very good. My guest this morning, Penny Hill, is here. She is the Infection Control Manager at San Juan Regional Medical Center. And Penny, we just have a couple minutes remaining this morning, so I would love for you to go through how you wash your hands and leave a bathroom for all of us, if you wouldn't mind.
Oh, I'd love to.
Because you've been telling me this for years, and as I said, I finally adopted everything you've told me for the past few years, so I'm doing it.
You've been so so much healthier, right?
Well, I knock on wood, I think so, but definitely this year for sure. But I think it's great advice, and I think a lot of folks can maybe see the benefits. If they couldn't before, we can now for sure with what's going on.
Well, think of it as germs are everywhere, especially in public restrooms.
Yeah.
So on all the handles, the handle going in, the handle leaving, on the faucets, and so you really have to figure out how to get out after you use the restroom. Then you clean your hands. So then your hands are clean. If you have paper towels, then use the paper towel to turn off the faucet. You don't want to touch that faucet after you've cleaned your hands. If there's no paper towels, sometimes I use my elbow
Right.
to turn off the faucets because I'm not going to be try not to touch my elbow after that. So then getting out the door is a little bit of a trick. If you can use, a paper towel to do that, that's great. Wait till somebody comes in. Quickly leave the door and stuff. If nobody comes in and you're waiting there and you have to leave,
Right.
then you can use maybe the inside of your jacket. That's a little tricky. That is a little tricky. A piece of toilet paper, if you needed to, you could take an extra piece of toilet paper just so that you don't have direct hands-on with the handles. Now, a lot of us these days have alcohol-based hand rub in our cars, right? I do.
Right.
I have some in my purse. I have some in my car. So when I get in there from the grocery store, when I get in there from any public place, then I use the alcohol-based hand rub on my hands as well. So that's another place that's another thing that you could do by getting out of the restroom and then use your alcohol-based hand rub on your hands, and that'll sanitize your hands, clean them as well.
Got it. But just, again, and great advice, and you've been telling this for years and years and years. It hasn't changed, but the conditions have changed, it seems, this year for sure. But that is kind of how germs spread, right? Is how from touching these things, and then if we touch our face, we're at risk. That's really what we're talking about.
That is true. That is true. So we take them from one surface, and germs can live on surfaces. So if the person before you's coughed or sneezed into their hands, and then they touch that doorknob and stuff, then you come right behind them. It can certainly live for hours, if not days, on some surfaces. So you touch that. You don't know that they were just there and put their germs on that, and then you rub your nose because it's itching, or you're rubbing your eyes and stuff, and that's how it's spread. Person to person has to get sort of in your body somehow through your eyes or your nose. But if your hands are clean, then that will prevent that from happening.
Right. Good advice. Well, wonderful. Penny Hill, thank you so much for joining us this morning. We certainly appreciate it, and you've been doing this for a long time, but you don't look it. But it's wonderful to see you and have you on the show and to share your advice with us.
Thank you so much. Everyone stay safe. Get your flu shot.
There you go.
Thanks so much, Scott.
Thank you.